Hi, everybody. Welcome to our presentation about resources and programs for myotonic dystrophy. My name is Leah Hellerstein. I'm the program director at Myotonic. And today's presentation will review all of the resources and programs that our foundation offers, as well as some external programs and resources. And this presentation is being recorded as of June 2020. You'll see on the screen a presentation outline for today. I will review internal resources and programs, including our care guidelines, toolkits, resources, and programs for newly diagnosed individuals. And then I'll also review external programs and resources, including insurance programs, Social Security, other social programs, and medical equipment. If you have questions that come up throughout the course of this presentation, please jot them down and email them to info@myotonic.org, and one of our staff members will be happy to help you. So to start off, we'd like to review some of the resources that are available on our website. You can see here on the screen the myotonic.org/toolkits-publications page is where we house the majority of our resources. So we have a variety of clinical care recommendations, some of which have been published recently as of June 2020. First, we'd like to call your attention to the respiratory care recommendations for myotonic dystrophy in the context of the COVID-19 pandemic. We highly recommend that you share these guidelines with your clinicians if you haven't already, especially your neurologist and respiratory team, so that they are aware of your needs as somebody who may have myotonic dystrophy in the context of the clinical needs of COVID-19. We have a variety of other clinical care recommendations here listed on the screen, including recommendations for adults with DM1, children with DM1, adults with DM2, and cardiologists and pulmonologists specific recommendations. So if you haven't already shared these with your providers, please consider it. These are all great resources for learning about the disease and helping your providers understand your clinical care needs. You can download all of these guidelines on our website, and we have a PDF version for all of these, and some of them also have quick reference guides, which are smaller versions with the condensed information. So moving on, we also have a variety of other guidelines that are helpful for clinicians, but also for individuals. These listed on the screen are a little more oriented towards families themselves. The language is a little bit different. So we encourage you to visit the same website I mentioned earlier, the Toolkits publications page on the website, and review the resources listed on the screen. If you're new to the DM community or are newer to caring for somebody with DM, we highly encourage you to review these resources at the start of care. The anesthesia guidelines are a guideline that we have produced many years ago and have been updated since. It's a very, very important document for anybody with DM and caregivers who are involved in care for someone with DM, as it explains all the needs that come with anesthesia and surgery. So we highly recommend that you take a look at that. There's a 10-page full document as well as a 2-page smaller document that you can pass on to your clinicians. We also have care guidelines for different clinicians in the care team. One of that would be the speech and language pathologists and those who care for pathologists who care for children and adults with DM. So those are on our website. We also have the role of physical therapy in the assessment and management of individuals with DM. This is for clinicians in the physical rehab center kind of situation, but that can also include physical therapists and exercise physiologists and people in that realm. So we encourage you to review, but also to pass them on to your rehab professionals. The occupational therapy guidelines are a pretty comprehensive guide developed years ago by one of our clinician partners who's an occupational therapist. We request you review those, but also to share with your occupational therapist in case they aren't as familiar with DM and the care needs that come with that. We have 2 recently published guidelines that we hope you'll review. One is the exercise guidelines for individuals with DM, and the other is the nutrition guidelines for individuals with DM. So both these documents are very oriented towards the community themselves, and we hope that you'll review both. We know they've been helpful so far, and we hope that they're helpful for your care. So in terms of toolkits, I just discussed more of the care recommendations, but now I'm going to talk more on the toolkits end. So our toolkits are oriented towards the community, families, and individuals with the disease and caregivers so that they can understand the different components come into care with this disease. As you all may know, the myotonic dystrophy is a very multifaceted disease, not only physically, but also psychosocially. So a lot of the toolkits that we've developed have are with the goal of addressing all of the different needs that may come into play. So first on the list, you'll see the Myotonic Toolkit. This is our kind of capstone resource that people will often request when they are new to the community or need a primer on myotonic dystrophy. So if you haven't already taken a look at our website and request a hard copy if you'd like. It's about a 50-page document that includes information on everything you need to know about DM, including symptom management, medication management, care teams, questions, and kind of the whole guide that you need to know. For those of you that are interested in applying for Social Security in the United States, we have a Social Security benefits toolkit. This is intended to help you manage and navigate the process of applying. If you're thinking about applying, this is a great first step. We highly encourage you to review this guide first before you start the process, as it can be a pretty lengthy process, and it's great to know what your options are before you start. One of our more recently developed toolkits is the Employment Access Toolkit, also available on our website as a PDF and in hard copy. And this toolkit reviews everything you need to know about looking for a job and navigating the work world with myotonic dystrophy. It's also a great resource if you already have a job and you're looking to learn more about your rights as somebody who may have a disability and needs some more accommodations in the workplace. So it's a really great resource to read up on the legal expertise that's needed to navigate this disease in the workplace. We have another toolkit here listed on the page, which is called Going to School with Myotonic Dystrophy, a guide to understanding special education and IDEA. So this is really specifically oriented towards parents and teachers and those who are navigating the world of myotonic dystrophy in the context of a child, so usually K-12. So it's a specific population, but if you're in that world, we definitely encourage you to check this out. It's a very comprehensive guide, very detailed, and has a lot of great resources. We recently developed the Health Insurance Considerations Guide for people living with DM in the United States. It's a smaller document, about 10 pages, helps you navigate and advocate for yourself in the insurance world. So there's a lot of great information about different types of insurance plans and just how to navigate that whole sense, which can be sometimes overwhelming. So if you're new to the insurance world, please take a look before you continue with your care. It will hopefully answer some of your questions. And last but not least, we have a guide recently developed for adults affected by juvenile onset myotonic dystrophy and their caregivers. So this is a specific population for, we call the JOA population, juvenile onset adults, who are individuals that are diagnosed with DM before the age of 18 or sometimes a little bit later, but they have unique and important cognitive and physical needs that are sometimes not present in adult onset DM1 or DM2. So if this is a population that you are a part of or you know someone, we definitely encourage you to check out this guide. It's very comprehensive. It has everything from social programs to mental health, psychosocial considerations, and all that comes with that population. So some additional resources to know about for everybody. The Clinic Visit Planner is one of our important note-taking guides. We have it as available on our website and also as a hard copy if you'd like some mailed to you. It's a 2-page double-sided document that has information just kind of to how do you organize your thoughts around your medical visits, as a lot of you may have various specialists. So this is a way to jot down your questions and keep everything organized for your visits. The Christopher Project Report is a report that's also on our website as a large PDF. We have hard copies as well if you'd like a hard copy. And this is a collaboration between some external DM advocacy organizations and ourselves, and it includes data about the DM population in more of a survey format, and it's a really great introduction to understand who else is in the DM community in the United States and Canada, and to understand kind of some of the symptom management and care needs that they have. If you'd like anesthesia wristbands mailed to you, we have those as well available. You can contact us at info@myotonic.org if you'd like to receive some of those. These are silicone wristbands that are white with the red imprint saying myotonic dystrophy, and just are great to have on you if you have the disease and are concerned that you might be in an emergency situation and you would like your providers to know that you have the disease, especially when it comes to anesthesia. We also used to use the wallet cards, and some people use those now, but we feel that the anesthesia wristbands are a little better just because they're more visibly on the body. So some other resources to know about from our website. We have the Study and Trial Resource Center, which houses all of our information about trials and resources in the study sense. So please take a look at that website. It is updated very frequently. We have the warm line, which is our phone line, which is staffed during regular business hours, Monday through Friday. If you have questions about navigating care, you need emotional support, you need to find a doctor, everything that comes in that realm, please feel free to reach out. We also have a map on our website, a Find a Doctor map, where you can zoom into your area and look for specialists in your area. If you don't see a doctor listed that you're looking for, please contact us. We can help you find one. And or if you have one and you don't see them listed, please let us know and we would love to add them to the list. We have a variety of financial resources on the website that have been developed and are still in development. We have a few states that we're still working on, but this page has about 40 different states listed with financial resources specific to each state. So if you're looking for a certain need, whether it's maybe rental assistance or medication help or anything related to COVID-19, please take a look at the financial resources page for your state and you might find your answer there. As I mentioned earlier, the juvenile onset adult program is something that it's a population we work with. And so we do house a specific program for them, and you'll see that listed on the link on the screen. And this program includes a support group on Facebook, as well as a camp, and are part of our JOA track at the conference. So you can see all the components listed. And if you are a part of that population, please reach out so we can connect you to those resources. And last but not least, the Digital Academy is our part of the website that houses all of our recordings, presentations, and different resources from conferences. So if you're looking for a question about a certain topic area, please put it in the Digital Academy and you can often find your answer there. So just to review quickly our support groups, we have a variety of great support groups that we hope you'll consider getting involved in. We have a variety of virtual phone-based groups, including a DM2 group, caregivers group, and a group for German-speaking individuals. We have a variety of in-person groups, which you can find listed on the support group map here on the screen. These groups are on hold as of June 2020 due to COVID-19, but we will be updating the calendar once these groups are back up and running. In normal times, these groups are pretty consistent. They happen once or twice a quarter per group, and you can find all the information for the facilitators listed on the website. We also have very active Facebook pages. If you're not already a part of the Facebook community, please consider joining, as this is a great way to receive support and learn from others who have the disease or are dealing with similar issues that you are as a caregiver or as an individual who's affected. So you can see on the screen the different groups we have. If you'd like to be added to any of the groups, just send your email us at info@myotonic and we can add you. And a quick review of our events. So we have a very comprehensive conference that we host every year. This year, 2020, we won't be hosting the conference because of the pandemic, unfortunately, but we will be hosting a virtual conference. So stay tuned for information about that. And the past conferences are all listed on the website with resources and presentations for each one. The Medical School Roadshow is an effort that we are consistently working on in collaboration with medical schools across the country to help educate the next generation of doctors about DM and help them inspire them to become clinicians in this field. So we are always looking for partner sites. If you know of any doctors or medical schools who would like to get involved with us, please reach out and we can try to connect with them. And then last, we have DM days, which are currently on hold as of June 2020, but normally we partner with different institutions to hold mini conferences throughout the country. And this is a way to bring together the community as well as clinicians in a smaller, close to home sense. So we will announce those DM days when we start scheduling them again. So just a little roadmap for if you're newly diagnosed or you're supporting somebody who is newly diagnosed. We just wanted to point you to a few resources on the website that might be helpful. If you're not already signed up for our emails, consider signing up. This is a great way to get communications. We send out a monthly dispatch, and as well as study reminders and different outreaches for different clinical trials. So it's a great way to keep up to date with what's going on. The body systems tool here listed is a way to figure out information about specific areas of the body that are affected by DM and how to get support and information on each one. It's an interactive tool, so you can click on the part of the body and then it'll bring you to some specific content. The genetic testing page is one of our most visited resources and asked about. If you are considering genetic testing or know someone who is, please take a look at this page. It will help answer a lot of your questions. It also houses information about 2 different companies that we work with who offer very subsidized rates for genetic testing, and is a great way to get a quick diagnosis. As I mentioned earlier, the dispatch is our monthly communication, our newsletter, and is a great way to get updates about the foundation and our work. You can see the archive of the past dispatches on the website. And if you're looking for more information, you have a question you just can't find answered, of course, you can always email us, but you also might want to look at the FAQs page, the frequently asked questions page, which is a way to get a little more in depth about some of the questions that you might be asking, but also see what other people might want to know as well. So that concludes the review of our internal programs. I'm going to quickly review some external programs just so everyone knows what's available to them. But of course, you can always reach out to us at the foundation. We're here to help you navigate all of the components of your care. But we just wanted to make sure you understand the other options that might be available to you. So I'll first review insurance programs, including Medicare, Medicaid, private insurance, TRICARE, and CHIP. And also note the link on the screen. This is the insurance guide. So a lot of the information we'll be reviewing, it comes straight from the guide. So it's nice to download a copy of that and have it if you need it for the future. So to review Medicare, many of you may already be enrolled, so you can ignore this part, but if you're not enrolled, consider enrolling. It's a great program for people who are 65 or older, or disabled and eligible for Social Security, or have end-stage renal disease. It is dependent on your work history and your work credits. You do have to qualify. And if you have questions about qualifications, you can visit Medicare.gov. To review the structure, there are three main parts of the program. Part A is for hospital-based inpatient care. Part B is for medical and outpatient care, and Part D is for prescription medication coverage. If you need advocacy assistance or help with enrolling in Medicare, please consider contacting your local HICAP branch. So HICAP, which stands for the Health Insurance Counseling and Advocacy Program, is a great local resource that can help guide you through the process of enrolling in Medicare and has free resources based on counties. So again, if you need help with navigating any components of Medicare, we're here to help you. Please remember that open enrollment for Medicare is in the fall, usually from October 15th to about December 1st-ish. So you'll always want to keep those dates in mind in case you're trying to make any changes to your plans. Those are really the main time of the year you'll be able to do that. So moving on to Medicaid, this is a separate program. It's kind of sometimes can get confusing with Medicare, but it's very different because it's mostly on a state-based level, whereas Medicare is a federal, countrywide administered program. Medicaid is the largest program providing medical and health-related services for some of the most low-income people in the United States. It's for children and for adults, but it's based on income eligibility. So whereas Medicare, I discussed, was based on work credits and paying into the system, Medicaid is solely based on how much money you receive per month. So each state has a different income limit. So you will need to review the federal poverty level guideline to see if your income in your state is approved for Medicaid. So you'll see some links on the screen. Please take a look at how to enroll in Medicaid if you are considering it. We can, of course, help you at the foundation as well, but the application process has to be done through your local Medicaid office. So please also keep in mind that people can have Medicare and Medicaid at the same time. So some people will have Medicare primary and a Medicaid secondary plan, which is great because Medicare will cover all of their basic costs, but then Medicaid will also subsidize any other out-of-pocket costs. Medicaid also covers some of the social benefits that Medicare does not cover. So that includes caregiving, long-term care, and as I said, premium and cost sharing. So it's a great program to enroll in if you are financially eligible. Private insurance. So many of you may already be enrolled and you don't need much help with this, but if you are part of an employer group where you need to choose a private insurance plan and maybe you're recently diagnosed, you may want to think about the different options that come with private insurance. Please consider pre-existing conditions, prescription medications, your physician preference, and your upcoming medical care needs when choosing your private insurance plan. If you are enrolled through your employer, you may only have certain options, but if you are considering enrolling through your state's health insurance exchange program, then you may have more options. So you can see here listed on the screen the healthcare.gov page, which is your place to navigate health insurance options on the private side. And these are all private pay plans, but there are various options within each plan. So if you need help navigating the plans, please let us know. Note that the health insurance exchange has their own open enrollment dates based on state. So you will have to consult your state's marketplace at the link here on the screen to find out eligibility options. So just a quick review of some other insurance programs. These are not as common, but they're good to know about. The Children's Health Insurance Program, called CHIP, covers medical care and dental care for uninsured children and teens up to age 19. This, again, is a very state-by-state program and often depends on income. So you'll see here on the screen a good link to help link you to that. If you are a veteran or part of the VA system, you can often get healthcare through that, and you'll want to consult your local VA program to find out more. TRICARE is an affiliate program, also military-based, and you'll also want to consult your local VA to find out more about it. And last but not least, Indian Health Services is a federal program that's for people of Indian Native American descent, and they will help you navigate the options if you're of that population. So I just reviewed insurance, but I want to go through Social Security as well, because as I mentioned earlier in the presentation, with our Social Security Toolkit, Social Security is a very complicated and complex topic, and a lot of you who are already enrolled will know this, but if you're not already enrolled, you have to put some time and effort into Social Security because it is a process. So to quickly review what it actually is, Social Security Disability Insurance is a program for people who have worked and paid into Social Security through their past employment, and they are now at a time where they would like to apply for SSDI, also known as Social Security Disability Insurance. So the qualifications are you must have a disability that is caused by injury severe enough to prevent you from working, and that disability is expected to last at least 12 months. So you can see socialsecurity.gov here on the screen is your #1 resource for applying and navigating this process. As I said earlier, though, please consult our Social Security Toolkit, because this is not only going to help you understand the qualifications, but it will also help you understand how myotonic dystrophy plays into the process, because there's very specific needs that people with DM have, and it's really important to note that in your application so that you don't get denied potentially the first time around. Do note, though, that it's very common for people to get denied on the first or second try, because unfortunately sometimes it's not as clear to the Social Security Administration that people with DM have such a variety of needs, and maybe if you were worked in the past or you have some needs that present as being more physically able, they will deny you based on that. So you have to be patient and you have to be a good advocate for yourself. But there are great organizations out there that can help you navigate the process, and please reach out to us if you'd like information about those resources. So supplemental security income is another program that falls under the Social Security Administration. So this is specifically for people who have limited work history, and it's income and asset based. So it's different from the one I just described because it's not based on your work history. So usually people are younger when they're applying for SSI. Often people may have mental health needs or diagnoses that would necessitate that program. So moving on, there's some other social programs that are important. General assistance program is one that you may know about based on your state. This is for people who maybe are not qualified for Social Security but need some general financial assistance. So you'll want to find out if your state offers that, and you'll see that link on the screen. The unemployment program is one that's based in most states, and they have unemployment benefits based on your county and often by your state. So you'll want to check out what you're eligible for. The short-term disability program is only offered in certain states. You'll want to check out if your state has that program. This is for people who need to take time off of work for a disability, and may receive compensation for that. The paid family leave program is a program for people who need to take time off to care for themselves or a family member and get paid for it. And you can also see on the screen here the link as to how to apply for that. The last resource listed on the screen is the food stamps page, and that's often based on your state. There's different eligibility criteria. They recently renamed that program to SNAP, which is just the same thing as food stamps, but if you are eligible, it's a financially eligible program. Take a look and see if it's appropriate for you. And last, I'd like to just quickly review durable medical equipment. Some of you may have called into the foundation in the past to ask about how do you navigate this process? So if you need any sort of medical equipment, which can look like a variety of things, canes, walkers, wheelchairs, modes, and more, contact your doctor or your care provider for a referral to get a authorization for the process. If you have a large copay for the equipment once it's processed, or you just don't know how to meet the financial cost that you have for this equipment, you can contact us, but you can also look at the financial resources page for your state. The Muscular Dystrophy Association, MDA, is another great resource for helping with financial assistance related to durable medical equipment. So you can contact them, and then of course contact us if you have any further needs related to medical equipment. So that concludes the presentation. Please reach out to us if you have any questions about resources, programs, and general healthcare navigation. We are here to help and support you. And if you'd like any of the toolkits that we discussed today, please email me at the address on the screen or at info@myotonic.org, and we'll be sure to send that to you. Thank you so much.